Hi guys. Breaking a bad news is the most toughest part of a nurse's life. It seems like those who have crossed over, those who have lost someone, it's their loss, personal loss. But breaking a bad news, we know how to tackle that situation, isn't it? There are certain do's and don'ts to how to break a bad news. Well, no comfort is going to comfort them. No soothing is going to soothe them because they have lost an integral part of their life. Today's video is all about how you can break a bad news. We know how to break bad news or how to comfort. We can say, sorry, I'm really sorry for your loss. It's not in our hands, and so on, isn't it? But there are certain standard protocols that being a nurse, you have to keep in your mind so as to how you are going to break news. And that too, a drastic news. We should look from the patient's perspective. His near or dear one is in the bed. I don't know since how long. Must be months, must be weeks, must be an year. And at last, what are they going to listen from the nurse or from the doctors is, we could do all we could. Now it's not in our hands. As if they have just given up. How the relative is going to take that? So, what can we keep in mind while breaking the particular bad news that there is no hope to the treated patient or for the treated patient? First of all, that I want you to keep in your mind is, you should not break this particular news all of a sudden. Whenever you're visiting the patient in their respective room or talking to the relatives, the subsequent visit, try to take it slow. Let them have an idea. Let them have an idea about the patient's particular situation. Let them have an idea about what treatment is going on and how far the treatment is successful. Allow time for the patient as well as for the relative to understand. Allow time for silence and tears. Be frank and compassionate when you're actually trying to say something that is not at all digestible, both for the patient and the relative. Do not speak in euphemism and jargons because you're speaking to a lay person. So you should speak to them in such a way that they can understand you did everything that you could. Now, either it's fate or it's God's decision, isn't it? You should always proceed at patient's pace. I know it's your job to speak to the relative and make him or her understand what the patient is actually going through. Or if the patient is conscious, you can have a conversation with patient as well. But proceed slowly. Just don't finish off your work and think in your mind like your work here is done. The rest and all is their business. Don't think like that. Whenever you get some time, visit the patient and the relative in that particular room. Talk to them. Let them tell you what they understood when you said this particular disastrous information to them. Are they taking it well? Are they all right with it? Have they actually been in that situation or that particular phase that they are all right? Nothing can shatter them more in future. So guys, I want you to keep these things in your mind, these particular points in your mind when you're about to break a bad news or when you're about to break a shattering news about a patient to their relatives. I hope this particular video will always be helpful. not only in your exams but also when you're working as a nurse in a real life scenario, as I say always. Thank you so much. Jacob John from Tiju's Academy.